Each week, hundreds of people gather for help from a charity started by Mark McDonald. It's a cruel irony that a man who devotes his life to feeding others doesn't have enough teeth to eat properly.
Virtually since 2019, I've been eating a soft mush diet.
5 years ago, the 61-year-old had radiotherapy for skin cancer. It damaged his salivary glands and his teeth started to rot. A retired nurse, he couldn't afford to pay $10,000 for treatment.
The pain was intense, your breath stunk, you were cautious about talking to people because you were worried about, overcoming them with really bad breath.
He eventually had all but 7 of his teeth removed. His hollow cheeks, a sign of the 25 kilos he's lost.
There's no pleasure in eating. It's a job you have to do.
Some Australians, including Mark, can get free public dental care in state-run clinics and hospitals, usually if they have a concession card. But waiting lists are jammed.
Even if you've been waiting, several years, well, you're still not the high priority for them.
How are you?
Associate Professor Ritalal Lalu has been tracking the wait for free care in Queensland for almost a decade.
The people who need to be seen more quickly are not being seen on time.
Long public waiting lists are seen across the country, but most Australians aren't eligible for free care, and 1 in 6 adults delay or avoid seeing a dentist because of the cost.
Financial barriers are so significant that people make the choice of suffering through their problems and not having them fixed, which I think is extremely unfortunate and sad that people have to make those choices.
Shockingly, 1 in 25 people aged 15 and over have no natural teeth. Poor oral health is also associated with other chronic conditions.
There's so many other costs involved in life at the moment, so dental work comes lower down the list.
There's nothing you can do. You can go on a waiting list or grin and bear it.
Jordan Steele-John is chairing a Senate committee into oral health care.
What we have in Australia is a system in decay, a dental health system that does not work for the community.
The Greens have long pushed to include dental in Medicare, which they say would cost about $77 billion over a decade. Successive governments have balked at the price tag of universal care. The current one says it acknowledges there are barriers to accessing affordable dental services, and it's committed to the long-term goal of expanding Medicare. The Australian Dental Association wants more public funding for vulnerable groups.
By targeting those socio-economic demographics that need it most, like those in aged care, Aboriginal and Torres Strait Islanders, and those with low incomes, we could assist in turning around the burden of Australia's oral disease.
After much lobbying and almost 2 years of waiting, Mark has now had bone grafts in his jaw. He'll go back on a waiting list for more treatment and still can't eat much.
I wouldn't mind a steak. It's been years since I've had a steak.
Emma Pollard, ABC News.